Well, all this month, we'll be sharing stories of Black excellence, culture, and resilience, introducing you to Cleveland trailblazers, both known and unknown. Tonight, I reintroduce you to a cancer survivor who has now become an advocate, helping people in the African-American community and beyond.
Let's go. 20 miles down, baby. Heartbreak. Heart restored.
In the freezing cold,
13 weeks, baby. Let's go.
they trained together.
The finish line is just the beginning.
The beginning of the next chapter of an important journey for John Johnson that started with a shocking diagnosis.
And I approached my whole cancer treatment like that, as if it was a blessing. And I know that's a very hard thing to comprehend.
Just weeks after beating his personal record in the Cleveland Marathon, John was diagnosed with stage 2 colorectal cancer. Doctors suggested he get a colonoscopy after he found blood in his stools. The procedure usually recommended for patients 45 and older with no previous family history of cancer. But John was just 35 years old. The potentially deadly diagnosis delivered 2 years ago on his wife's birthday. The couple also found out they were pregnant with their second child.
As I said, I'm not gonna be a victim of this. I'm gonna own it, and I'm gonna do everything I can.
Cleveland Clinic colorectal surgeon Dr. David Rosen was in charge of John's case.
He focused so much more on positivity and optimism and not letting the cancer define him.
John underwent weeks of radiation followed by months of chemo. Just weeks before his son was born, John learned the cancer was gone.
Really thinking about thriving and using that experience to not only change my life, but help to hopefully change the lives of others.
I know how to treat patients and take care of it, but is there more I could be doing on the advocacy and awareness side?
It was then that the doctor-patient relationship transitioned into a friendship, conquering colon cancer on a much bigger level. Dr. Rosen decided to join John, who was already training for the Boston Marathon. Now the Cleveland Clinic's sponsoring them as they run alongside each other to raise awareness and money for Detect Together, a nonprofit helping to identify early detection of cancer.
We in the medical community with regards to colorectal cancer are terrified about it because there's this huge uptick in the patients, the younger patients who are experiencing this, and it's terrifying that we don't know exactly why.
Specifically men, and then you add the layer of African American men, they don't like to talk about it. Right? There's a stigma around it. There's a lot of fear tied to it that I found. People like myself who look like them that are telling them, hey, just go, because my life was literally saved.
Who's a faster runner?
He's definitely faster, but I need it because I'm the underdog, and so he has everything riding on this, because if I beat him, then I got bragging rights for a long time, don't I?
He's been running like this the whole interval. He's a machine.
John and Dr. Rosen's goal is to cross the finish line in less than 3 hours. But the long distance run to beat cancer is lifelong, just like their friendship that started with a doctor curing his patient, getting him to the other side of being cancer-free. Well, for more information on colorectal cancer, and if you want to support John and Dr. Rosen on their mission, head to our website, cleveland19.com.